Almost 38 million people around the world live with HIV. While vaccine trials are to start this year, decades of research have yet to yield a cure. But medical advances in the form of antiretroviral drugs mean fewer people are dying from AIDS. There were 770,000 AIDS-related deaths last year, down 30% from 2010 and down more than 50% since its peak in 2004. It's driven by progress in Eastern and Southern Africa, but globally, it's a mixed picture. The number of deaths in the Middle East and North Africa have risen by 9% since 2010 and 5% in Eastern Europe and Central Asia. HIV infection cases have dropped 16% since 2010, but new infections amongst children have risen by more than 160,000 last year alone, passed on by HIV-positive mothers during pregnancy, childbirth or breastfeeding. The UN says some groups of people, as well as their sexual partners, are particularly vulnerable to contracting HIV. They include those who inject drugs, gay men, sex workers and prisoners. The UN says they continue to be marginalised and left behind in the response to HIV. Antiretroviral drugs are helping millions to live full lives, but not everyone in every part of the world has access to those drugs. And despite global education efforts, it's estimated that 25% of everyone with the virus, that's about 9 million people, don't even know they have it. It's 35 years since the cause of AIDS, the HIV virus, was first identified. The UN is warning worldwide gains against HIV/AIDS are slowing due to a shortfall of nearly $1 billion in donations to fight it.